I'm Dr. Kelly Starrett with the Ready State. Today we have a real great case study about how we might use H-wave with an acute recent trauma. And when I put trauma in quotation marks, on a hike with Lisa, fell, slipped, put her hand down, doesn't appear that something is broken and she needs emergency medical attention, right? There's no bone sticking out, not numb and tingly, she's been evaluated by her physical therapist. He has decided that she probably doesn't need a follow-on radiograph. But one of the things we want to talk about is how we might integrate H-wave, which we have laying around the house, and how that might be a great entree into beginning to manage post-traumatic swelling and to have some immediate pain relief. So there's a couple things that we've got going on here. Number one is, I'm just going to turn them both off, Lise, is that we've got a set of pads going right through the joint line, right at the wrist here. So Lisa could move the pads to go front to back, but we've just got pads going kind of right on either side of the joint here at the wrist. She's going to opt for high frequency here. And what's nice about when I have a joint trauma or joint injury or joint strain, whatever the appropriate language is, that Lisa can identify sort of where she wants pad placement. We're looking for some on-demand pain relief to give us some sort of immediate, sort of down-threatening information, down-regulation of that threatening information of the strain. And so she's just going to turn this on. She can run that until she gets a pleasant buzz that is comfortable and not putting the musculature or the associated tissues into sort of a tonic kind of lock. And that might change over time. But ultimately, she's in control of this. She finds a pleasant buzzing sensation. And now what's going to be nice is not only is she going to get some on-demand pain relief in this moment, but she potentially has 2 or 3 hours of follow-along pain relief. And that might mean that, hey, this isn't appropriate for a sling or a brace, right? It's just a strain, like a turned ankle, but Lisa may have to use her hand for work. She might have to type, she might have to work, she might have to lift using her arm, and this can be a really powerful way to break that cycle without having to introduce non-steroidal anti-inflammatory drugs or potentially a person self-soothing with bourbon and something else, right? So here's the one thing is that we've immediately got some pain relief, and we just got pads on either side of the joint. That's going to help manage sort of this discomfort. The other thing that we're going to think about is that Lisa has a pad right here. It's on the flexor mass. She's got something on the extensors. And then she's going to just tune that up on low frequency until she gets a pleasant pumping. Because one of the things that we're thinking about here is that no matter what is going on, Lisa needs to evacuate the congestion that's secondary to some trauma, or in this case, this kind of FOOSH, fall with outstretched arm or fall with outstretched hand. And what's nice about this is that Lisa can control the sort of, well, there you go, put it on low, and then dial it up until you get a little pump going. You got a little pump going there?
Yeah, yeah.
Okay. The rules of thumb for us is that no matter how acute, let's say she's in a brace, she's going to see a physician, right? Or, hey, I've just strained myself and I don't need to have kind of formal medical intervention. Bottom line is that the pumping should never irritate or hurt the injury site. And so if this was even a low-level pumping was hurting her wrist in any way, we would say, hey, let's move the pads away, even if we needed to move up the chain and completely away from the moving tissue. So in this situation, she might be able to work on her extensors or her flexors and find a pump that's low level that doesn't irritate her initial sort of complaint or trauma, or she moves the pads up the chain in a way that we're not seeing any movement in that very sensitized tissue. And so regardless of, she could still be using high frequency here at the joint, but she might choose to move the pads up to the biceps, the triceps, because remember, we're just ultimately pumping the whole lymphatic system up into the sort of the chest. And so the bottom line is that in this situation, now even if Lisa was waiting to be evaluated by an orthopod, right, in this situation she can still get ahead of the swelling, she can give herself some on-demand pain relief, and what we have now is a really safe, sort of very potent intervention where we're managing the swelling, we're not making the complaint worse, and we're giving ourselves some on-demand pain relief. And this is something you could, You could play cornhole still, right? You could do all of the things that you needed to do on a Friday night because it's Friday and you might not be able to evaluate it until Monday. So in this situation, what's great about having access to an H-wave is it can get us rolling on managing symptoms. In this situation, doesn't seem like it's very severe, but certainly painful. And a lot of times it's the swelling and congestion secondary to just a little sprain or strain that's actually causing this to become a lot more uncomfortable. Initially, when you talked about it, you're like, hey, I think I sprained my wrist. Now it's starting to swell a little bit and you're starting to feel a little bit more sort of discomfort. So if we can get ahead of that, because that hand is in the bottom of a gravity well and it's just kind of constantly swelling and we're not evacuating that congestion because we can't get a lot of movement out of the hand. Lisa's been doing this all day. This can be a really potent adjunct to having her be able to manage congestion and manage pain while she's either waiting to be evaluated or, hey, this is just a little tweak and on Monday we're going to get back to it. So 2 cases of how we're using high frequency for some on-demand pain relief, low frequency for pumping, in a case study for a real person in a real trauma injury. Thanks, Lisa.
Sure.